Hi everyone, welcome back to my channel. So today I want to talk to you about where I am in this endometriosis journey thus far. Um, it's been so bizarre this year because I wasn't expecting this diagnosis at all. And it kind of came out of the blue. If you don't know, I'm not sure if I talked about it in a previous video. I have an oncologist, and I've explained why I have an oncologist in another video. I won't get into that. And she was seeing some tumor markers fluctuating. They were not out of range, but she's very cautious, and she ordered, one of the tumor markers was like for ovarian cancer. So she ordered an ultrasound, and we found an endometrioma on the right ovary. I've already been reassured by basically all of these gynecologists that it isn't cancer. So we're not looking at cancer, but we are looking at endometriosis at this point. The endometrioma is about 4 centimeters. Depending on what doctor you consult, they don't become problematic or they don't become urgent until they're around 6 centimeters. If you research online, once they hit 4 centimeters, that's when doctors, start to, consider surgery, or that's when they are supposed to start to consider surgery. I've seen about 4 gynecologists at this point, and I have a lot of feelings about it, so we'll talk about that. So I had seen a gynecologist, I believe at the beginning of this year. It might have been January or February. It was very, very early in the year, and I have been having infections. If you've been with my channel for a while, you know that I had ureaplasma at the end of 2023 coming into 2024. I literally did my treatment like through New Year's, and I was able to get rid of the ureaplasma with I guess the antibiotics that I did. And things have not been right down there ever since, but I don't have ureaplasma. I've been tested and retested. I don't have ureaplasma. About, I want to say like 7 months later, around November-ish, I started testing positive for BV again, and I just won't stop testing positive for BV. I've done just about everything, boric acid, antibiotics, everything, crazy stuff. And it just seems to keep coming back, or probably just not going away in the first place. I don't have any antibiotic resistance. The bacteria has been tested for antibiotic resistance, so I really wasn't sure what the problem was. And my ureaplasma it had not come back, so it wasn't the ureaplasma. That is why I went to go see that first gynecologist in January, because the urgent care was just tired. They hate to see me coming, and they were just like, we can't keep helping you with this. You need to see a gynecologist. So I booked the first gynecologist that I could that was close by, and that was a mistake. But I went to him, and I said, I think there's something, going on, because I can't get rid of these infections. And it's just not, it's just weird. Like usually clindamycin, the clindamycin cream would clear them up. They would still come back the next month, but clindamycin seemed to work really well until I got the ureaplasma. Clindamycin doesn't work on ureaplasma, but the ureaplasma is gone. So he suggested boric acid. He said sometimes you have to take it, you have to use it for up to 3 months. I had actually spoken to an infectious disease doctor around that same time as well, and he said the same thing. He said boric acid, probably long term would be another, probably the best course of action. Keep in mind, at this point, I have no idea that I have endometriosis. So that, I think, was in January sometime. I was very frustrated, but I was like, whatever, like this is not, I'm not getting anywhere, and this is not helping, and I'm just going to have to figure it out. I'm going to have to try the boric acid. I subscribe to the the EV tests, which are vaginal microbiome tests that you do, you order them, and then I did a subscription. I actually just recently did my last one, my 4th one, And let me tell you, just a waste of money because it doesn't even pick up on that specific bacteria that is causing my BV. So I was going to do a review on those for my channel. I think I've done some reviews on the different tests, but I haven't, I think some of them I haven't posted because I think it's kind of besides the point now that I have this diagnosis. So during that time, I'm seeing my oncologist. You know, I think in April was when we got the results, but I think it must have been March, sometime around March. She said, your numbers are kind of fluctuating. I think we should do an ultrasound and see if there's anything going on in there. I said, fine. And during that time, I was also going to all these other doctors. I went to the Cedars GI clinic, which I will have a video on my channel about my experience there. And I actually had one of the residents that was taking down my medical history. She mentioned to me, she said, a lot of the symptoms that you have can be related to endo. Have you been checked for that? And I was like, no, like, why would I be checked for that? But I had already had the ultrasound at that point. So when I got home, I checked to see if the ultrasound results were in my portal, and they were there, and I saw that I had an endometrioma. So once I saw that, I was like, what is that? And found out that it is technically endometriosis. I start researching, I start reading, I'm on Reddit. I joined the endometriosis group on Reddit. It's literally like I'm dealing with all these things, and then now I get this new thing, and now I'm like back at square one with this situation. So I ended up seeing 3 more gynecologists after that initial one. So I saw one before I knew I had endo. Then I saw 3. I immediately started scheduling with other doctors because I knew that I was going to have to get a first, second, and third opinion because now I have an actual condition. I did leave a review for that first one because I asked him, I said, you don't think that we should run some other tests? And he goes, no. He said, if you're having a period, you're fertile. I don't care about that. But I also know that that's not necessarily true. So definitely left him a bad review because he didn't want to order any other tests. And here we are. So if there's any advice that I can give you is never trust your doctors. Especially if they keep refuse to order tests. If they give you a hard time, keep at it. So, and by the way, my oncologist is incredible. I feel like she's the opposite. She orders tests for any little reason, and I appreciate her for that. So the first gynecologist, they said that this place said that they specialized in endometriosis. They did not. They are gynecological oncologists. So they specialize in things like ovarian cancer, probably uterine cancer, any kind of cancer, and, female cancers, I guess. And he just kind of had an attitude a little bit. He did see me very quickly. They did give me like an appointment right away. It was really, I was, very happy about that, but he wasn't great. And he was an older guy. He's the first gynecologist that I saw was a male. This guy was also a male, and he's kind of like a surgeon as well, gynecological oncologist, and he does surgeries. So I'm sitting in there, and he flat out just looks at me. He's like, you don't have cancer. And I'm just sitting there like, I'm not here to talk about cancer. But he reassured me. He said, you don't have cancer. At that point, my oncologist had ordered an MRI because we had seen that I had this thing on my ovary. So she said, I'm going to order an MRI, I guess, so that we can get a clear picture. This gynecologist thought it was really funny, and he goes, wow, your doctor really likes to order tests, doesn't she? And I was just like, he was just rude and, very like kind of stuck up, like just he knew better than any other doctor. And I was like, you guys are both oncologists, so I don't know, there's no competition here. And basically he said, just go to Cedars, because I was planning on going to Cedars. You know, my oncologist agreed you should probably go to Cedars. So he said, just go to Cedars. So I wasn't satisfied with that. He did tell me, now of all the gynecologists I've seen, he's the only one that said, you need to get that cyst removed and then you need to go on medication. He is the only one that has said that I need to have surgery to get it removed. After him, I was able to book another quick appointment with a gynecologist. It was kind of an accident. I wasn't supposed to be able to book because it was a first time appointment, but they booked it anyways. And I got in to see her, and she basically was just going to push birth control. And that's basically what most gynecologists will do when you have endometriosis. I had already read about that most doctors will just push the birth control situation. So, you know, she at least informed me. She was really great. The reason I saw her is because she was on a list for doctors that will not like put up a fight if you want to get your tubes taken out. So she seems pretty progressive and pretty open-minded. And to be honest, I had mentioned that to her, and she didn't suggest any type of surgery or anything like that. She just kept saying, you know, there's a lot of different types of birth controls, and she listed all of them. She said, you can try this, you can try this, you can try this, you can try this, you can try this. And I was like, you know, I'm not against birth control. My issue is that I have a lot of sensitivities, a lot of stomach issues. I can barely tolerate food as it is. You add hormonal birth control on that, and I don't even want to know what would happen. On top of the fact that one of the primary side effects is nausea and vomiting, and I already have a bunch of stomach issues, right? That's what one of my main issues is. So, you know, I told her, I said, birth control I don't think is going to be an option right now, but, you know, I said, I don't know. I don't know much about this condition. I was still researching it. She said, let's just keep an eye on it. Let's schedule another ultrasound 3 months from the first one to see where you're at. And she did, out of all these doctors, she was the only one that did an exam. She went in there, she was poking and prodding. She did a swab because I told her I was having infections. She, she did the full pelvic exam. I mean, she was just really in there. She did the HPV test and everything. So I was like, she at least did something, right? Like the other doctors are just sitting there talking to me. Not a single one is going to go in there and look, which again, I'm sure that would give you some information if you're looking in there. I'm pretty sure you could see if things are inflamed or if there's a lot of, you know, stuff in there. She was the only one. So I have to at least hand it to her. I did like her as a regular gynecologist, and I hope to see her again next year just for my yearly situation. But she was also just like, you know, birth control, do that. So I was like, okay, so she's number 3, but number 2 post endo discovery. And now we have to go to Cedars because I said I was going to go to Cedars. And basically the doctor there was very similar to her, except I felt like she was actually less knowledgeable. She's pushing birth control, and she said, I'm going to give you a couple months of samples for you to try. And then I'll see you in a couple months, and then we can talk about it. You know, she said, and we'll do an ultrasound at that appointment. So the other doctor, we never scheduled an ultrasound with her. I figured I might as well just do it at Cedars. And I get to do it the same day that I do my follow-up with the gynecologist. So, you know, we already kind of knew how big this thing was on my ovary. They have to monitor them for growth because, like I said, once they get to a certain size, they can twist your ovary, which is very, very painful. That's kind of where my mind is at right now, is that I'm wondering, you know, at what point are we going to get to where the doctor is like, you know what, we need to get this thing taken out, because I am not having severe pain at this point, nor do I want to have that. So I'm kind of like, what are we waiting for, right? So I just had my follow-up with this gynecologist. You know, she was like, I did see that you didn't fill the prescription. She'd given me, I think, a couple months. I don't know why I would fill the prescription if I already had 2 months worth of birth control. But she said, I saw that you didn't fill the prescription. I figured you were going to lean towards surgery, which she had not been advising me to get surgery the first time I saw her. She actually kind of was like advising me against it. But she just doesn't seem very knowledgeable. I had a lot of, I've been doing a lot of research. I listened to this podcast where this woman that's had endo for 15 years, or for more than 15 years, she interviews all the top surgeons and researchers for endo in the world. And I mean, these are the people that know about this thing, and they have, the information is completely different. It's nothing like what this gynecologist is telling me. And so, she was just like, you're still, even if you get surgery, you're still going to have to go on birth control or on medication. And I'm just sitting there like, you're so hell-bent on this medication. Even though I told her, I said my tolerance is very, very poor for just about everything, not just medication, but food and everything else. So she said, I am going to give you that referral to our MIGS team. MIGS it stands for minimally invasive gynecological surgery. And she said, and we're going to order another MRI. And I'm just sitting there because I actually had that MRI from my other doctor. We did do the MRI. It kind of didn't go that great, but we did see the endometrioma. It was about 4 centimeters. And so she's like, we're going to order another MRI. And I'm just like, I guess, whatever. And she said, we do it, I guess they have a certain endometriosis protocol. A lot of times they want to give you contrast. I will not take the contrast. I like I said, I react to everything. So I did get the referral. I've scheduled everything. The MRI is in October. The consultation with the surgeon is in November. I don't recognize the name of the surgeon at all. I did a Google search. She's not coming up anywhere. I have no idea who this is, right? So one thing that I have read is that you do not want a beginner surgeon. Obviously every surgeon has to start somewhere, but it is, there's kind of a sweet spot when it comes to a surgeon. But here's the other thing. So I'm going to, kind of get into a little bit more here. So I have this stuff, scheduled, the MRI, the referral to the surgeon. This is through Cedars. But I know that I'm going to have to get a second opinion, possibly a third. So I'm going to have to see a couple of surgeons. So I did look through the Reddit. And keep in mind, I have Medicare and Medicaid. It's pretty rough to find a qualified surgeon, particularly for this condition, with that kind of insurance. It's hard enough with really good insurance. So, I called UCLA because I'm already in their system. I was previously diagnosed with stiff person syndrome at UCLA, and I figured that might be a good place to go for another opinion. And the name of the surgeon there came up in the Reddit, the subreddit for endometriosis. The two things, the two little reviews that people left, they really like the guy. He looks very young though, so he might be sort of a newer, surgeon, but it seems like he's doing a lot of surgeries. So that's one thing that you need to look for in an endo surgeon. They have to be doing a lot of surgeries. So I was able to schedule with him for next year for February. So he's booked out until next year, which I consider it a good thing because that means that he's doing surgeries. He's doing stuff, I also contacted something called the Endosurgical Specialists International, which I guess is like, it's not an organization. It's another, and they're endometriosis surgeons and specialists. I also found them through the endometriosis subreddit, but somebody had said that if you don't have like comprehensive insurance to go with them, and I was just like, that doesn't make sense because it's out of pocket. So, but I thought to myself, these are experts. These are the experts. Their prices are not as insane as some others that I have seen that charge out of pocket. Like I've seen, there's one lady like in Beverly Hills that charges like $80,000 or something insane. These prices are not like that. It's still expensive because you're paying out of pocket, but it is not $80,000. So I figured I'd do that. I think the consultation doesn't cost you anything, but once they start doing the other stuff, they do other, other scans and things like that, then you start having to pay money. And of course, if you have Medicare and Medicaid, you're paying out of pocket. You're considered a cash pay patient because they don't take that insurance. And I don't think you can even bill Medicare. I would have to find out. But I just filled out the paperwork for them today. And I am kind of looking forward to at least talking with them and seeing, I wonder if I could get some of the stuff done with them and then just, maybe get everything else done somewhere else. But since they are the experts, these are a very highly qualified surgeon. And then they also have I think a colorectal specialist, because sometimes you get endometriosis on your intestines and that kind of thing. So I figured there might be some good information to get from this consultation and possibly any other kinds of, testing or imaging done that I'm willing to pay out of pocket for it if it shows something, because so far the MRI has not shown much with the exception of the endometrioma. Same with the ultrasound. But a lot of times they say that it depends on the technician, it depends on who's reading the images, and it depends on their expertise. Obviously my oncologist is not, she literally didn't even tell me about the endometrioma. So it's not something that's going to be on her radar unless it's cancerous. So that's where I'm at. I am just waiting on the endosurgical specialist and waiting on all these other appointments. And you have to just do your research. I'm lucky that I'm not lucky, but I don't work, so I can focus all of my energy on doing the research to make sure that I don't make a bad decision. I have read, especially in the endo subreddit, there are women, many, many years ago that had surgery with the first doctor that was willing to do it, and it didn't go well, right? Because there wasn't a lot of information about it back then, and they didn't know any better either. So a lot of times, it just takes your research and, looking into the situation, learning from other people's experiences. And that's what I'm doing. I am fortunate that, if you guys have seen my other videos, there are things that I have done that have helped my period pain, by accident. So I'm lucky that I'm not in such severe pain that I'm desperate to have surgery. There are people that are desperate for it. And when you're in pain, you end up making hasty decisions. And that's why people end up getting surgery with the first person willing to do it. So I'm lucky in that sense that I can wait. My concern is this thing is going to keep getting bigger. We did see that it went from, the MRI caught it at 4 centimeters. The first ultrasound caught it at 3.6 centimeters. And my most recent ultrasound, I think it was like 4.2 centimeters. So I would say it is growing, but it's growing very slowly, right? So I think I do have time, but I also don't want to wait until I get to a point where I suddenly have severe pain again. So anyways, thank you so much for joining me. Please like and subscribe, and I will see you in the next one.